this right away, like you mentioned, with a very young child was that was really reassuring. Doctor Soni made sure that he addressed all concerns or laid out potential problems and really reassured us on why we should get it done right away instead of doing it later in the years, which I think is proving really advantageous for us because the baby is recovering very well. The exercises is
So, first I would just want you to introduce yourself and tell us how small the baby is and what's the concern with the baby.
Okay, so hi, I'm Nandita and we just had a baby about a month ago, and the problem with her was she was born with a tongue tie and a lip tie, which is making feeding much harder for her and me. My concerns were still like very small compared to what she was going through, which was not able to feed very correctly or her not being full or more than that, like sucking up a lot of air, which was creating a lot of gas. So which is around the time when we decided to remove that, which was to release her pain, and that's how we got in touch with Dr. Abhishek, and he really addressed all our concerns. He made sure that we were much more relaxed with the procedure, explained everything well, and importantly he's also been guiding us very well through the exercises so that it doesn't reattach, because that's also a bigger concern with this. And yeah, so far we're really thrilled we got it done so soon, despite there being a lot of protest against us doing it right away, because
Family must be saying, I'm pretty sure.
Yeah, they just hate the idea of getting something done on such a small kid, and it is scary. It is scary. We ourselves are pretty scared. But yeah, it's been good so far, and she is happy, so we are happy.
Okay, so what were the initial chief complaints or concerns that you got us? Like, first of all, you came to know that it's a tongue tie, and what brought you here?
Right. So I was recommended, of course, to Dr. Abhishek. Before this, we honestly did not know that this is something that happens with little kids, or that they're born with it. And we realized that this is something eventually down the line we'll have to get rid of, but it was not a primary concern right away. What really encouraged us to come over here once again was core her problem. And what really helped is when we spoke to Dr. Abhishek, he talked a lot about how he's done this many times before and how it's a very common problem, because as parents, especially who've never heard of this, it can be pretty concerning, like why does my kid have this? So it was nice to also know that okay, this is a very common problem and many parents get rid of it early on instead of waiting a longer time, which was going to be our action plan to begin with. So yeah, that's how we came here.
Okay, so initially you were advised to go ahead with general anesthesia.
Yeah, so that was another thing. So we actually had to change our pediatrician, and he had recommended going to a pediatric surgeon, because this is typically, or this is something that was handled by surgeons earlier. But the thing is, with the laser and the fact that you don't have to put them completely under, just general anesthesia as the trick. So that's another reason why we were sold here, because the process was quick as opposed to a surgery where you have to get your baby admitted. The entire operation process needs to be, or the procedure needs to be followed, where you don't feed them for a while. Then they do the process, and then there's oxygen inside their mouth so that they don't lose oxygen to the brain. So all of that was much scarier, and I'm really glad we live in a time where it is so easy now, because imagining parents doing this so early on, it sounds pretty stressful. But yeah, so that's why we're super glad.
So how was the treatment day for you and the baby, and can you walk us through as to how do you felt before and after the procedure?
So before the procedure, we were pretty confident that it can be, because based on the people we spoke to once we started researching this, there were some concerns around like bleeding and of course the obvious reattachment part, but it does not seem that daunting anymore, given the fact that bleeding is like I think very less common nowadays as opposed to earlier. So yeah, if there is anybody that's considering this, then yeah, getting it done sooner is always a better option.
So did you, when you were researching, what did you come across that if you're doing it later, how does it affect the baby? What was your research like?
Yeah. So the prime concern we were addressing here is babies that suck in a lot of air or are having feeding issues this early on because of a tongue tie end up getting very colicky. And colic, yes, it's usually something that resolves itself in 3 months time. But the thing is, those 3 months are pretty crucial for their growth because they're solely reliant on the feed. So which is why one of the researchers said that getting it done now is ideal instead of later on. And another concern is when the kid is about a year old or something, you are not fully in control of getting those exercises done. They themselves are much more fussier in a whole different way than how a newborn is, or at least for now, soothing a newborn is easier than soothing a 1-year-old.
Trust me, I have a 1-year-old.
So yeah, that was a concern laid out. And another thing we realized is, many women don't have a nursing issue, or many kids with tongue ties don't have a feeding issue. But by the time the tongue tie starts affecting the kid, the speech issues or the teeth rearrangement, the kid is already 5-6 years old. So it's a whole different kind of pain, because then you have to realign those teeth and then get it done at that age. Or if they've already developed some speech issues, then getting a speech therapist involved. So that was what our research said, and which is why getting it done sooner was easier. And it has worked, because she does not cry as much as she did, and the transformation literally happened in the hour post surgery. She's also a little less gassy than what she used to be, and feeding time is much more convenient now, because she does not have those challenges like swallowing and everything. So yeah.
So the surgery was done yesterday?
Yeah, yesterday.
Okay, so in 1 day you were feeling that there's less colic and she's able to feed better.
Correct.
And this is from the kid's perspective. As a mother, are you feeling comfortable latching her? Or
there are some issues, but the thing is, I think what was the prime concern was the draining correctly was not happening, or when it did, a lot of it was puked out by the baby. So that was like a very big concern for us, like, if everything's coming out, what is going in? Yeah, so that is happening a lot less now. Like, there is still some spit up, but that's fine, right? It's and pediatricians usually are not that concerned with vomits, because it's usually normal, it's a regular course, but the thing is, it just means that the baby is going to feed again. And if the baby or the mother are also having feeding issues, then it's a different kind of a challenge, because you kind of want to get it done, get it right at once, because if you're going through pain, then it just, so
okay, how was the atmosphere and the care that you received at the Smiles.dental?
Okay, so the atmosphere was pretty relaxed, right? Right from the doctor with the staff, everybody was pretty okay, because they've done this before. The training is all done very well. Plus, it's literally like a 10-minute process. So you see your kid throughout just those 10 minutes. You're on there, and the amazing part is you have to feed your kid right after. So even if you feel like, okay, there's been something wrong, or something's happening, there's everybody to address those concerns. and I like that you know everybody can answer because they've done it that many times, so that was pretty reassuring.
Okay, cool. Thank you so much.
Thank you.
Sorry.